Hi, I'm Stephanie Wolff, PA and CEO of the Novus Center.
And I'm David Dumbroski, the Center Director for the Novus Center.
And today we're going to discuss what exactly is Peyronie's disease. Peyronie's disease is a connective tissue disorder that's caused by a fibrotic lesion or plaque within the tunica albuginea. And this causes a penile deformity, whether that's just a bend in the penis or perhaps some scar tissue or palpable nodules. The tunica albuginea is a non-vascularized, thick, fibrous-rich layer of structural collagen and other extracellular proteins that surround the corpus cavernosum, or the shaft of the penis. This tissue is responsible for allowing the blood pressure to fill up within the cavernosum of the penis, which assists or aids in your erections. If you think about the corpus cavernosum as a sponge, you're gonna fill the sponge up with water, right? So you put the water in the sponge expands. How do I keep that water in that sponge so that it's not leaking back? Well, you're gonna need to create some kind of seal, and that seal is the tunica albuginea. It's going to basically layer that sponge and hold that water in the sponge so that the water doesn't come out of the sponge. That's basically what it's doing for the penis. So blood flow is gonna flow through the corpus cavernosum, and then that tunica albuginea is going to expand, causing that blood pressure to fill up. And then it's going to halt the valves, or basically stop the valves of the veins so that the blood doesn't go back and the blood is going to stay in the corpus cavernosum. Now there are two phases of Peyronie's disease, the acute inflammatory phase and the chronic calcifying phase. I would say the majority of the patients that we see come in during the acute inflammatory phase. And what they're coming in with is painful erections. And the reason why they're having painful erections is because they have this soft, palpable scar tissue or nodule that's causing the bend in their penis. Remember, I said it was occurring in their tunica albuginea, and that's that outer layer of the penis. So it causes that bend that then gives them a painful erection. And so these guys are really doing everything in their power not to get an erection because, again, it's painful. So they come in and they're very easy for us to treat because, again, they're in the acute phase of it. Everyone's a little bit different, but I would say for the most part, 3 to 6 to 10 treatments, again, just based on how much curvature you have, how much pain you have, and how much scar tissue you have. The second phase is the chronic calcifying phase. This is the most difficult for us to treat with you guys. What this means is you've let this go for at least a year. You knew about it, you had the painful erections, you didn't know how to treat it, you let it go. And what happened was that acute inflammatory phase turned into chronic calcifying phase. So you no longer have a painful erection, so you were kind of like, hey, I can still get an erection, it's not painful, I'm fine. But that soft, palpable lesion or nodule begins to calcify like bone. So now it feels like a marble. And this is going to take us a lot longer to break down. One of the instances I'll use with my patients is think of it like I'm peeling an onion and I have to get the layers off. I don't know how many layers are underneath. I don't know how long that's gonna take, but there are a lot of layers. So again, the chronic calcifying phase takes a lot longer for us to treat, whereas the acute inflammatory phase is fairly simple and straightforward. So if you are experiencing any kind of bend in your penis, any kind of scar tissue or painful erections, please call our office right away so that we can start treatment on you and get this resolved before it turns into a chronic phase.
So what exactly caused your Peyronie's disease to occur? Whether that's a penile deformity, a curve in the shaft of the penis, or just a chunk of scar tissue down there, there's lots of different causes. It can be a sports-related injury. We've got a couple of boxers who have taken one too many hits below the belt. It can be obviously a sexual-related injury. You go left and your partner goes right, ouch. But it can also be caused by autoimmune diseases or a family history of Peyronie's disease. Many men who come in here who have had prostate surgery have Peyronie's disease. And diabetes, huge one. A lot of our patients are diabetic. What do all of these cause? Inflammation and swelling of the tunica albuginea.
Now, this inflammation and swelling of the tunica albuginea will send a message to the brain telling the brain that there's been damage and that the brain needs to send growth factors and healing properties, fibroblasts, and collagen production. Because the brain wants to repair this damaged tissue. So it sends all this down, and this repair, or what I like to say lack of repair or faulty repair, will then create this scar tissue or the dense tissue. The body is trying to do the best that it can with this inflammation and swelling, trying to repair this injury, and sometimes it just doesn't repair it the way it's supposed to.
So this faulty repair that your body's trying to do ends up creating scar tissue, also called plaque. And that means guys are looking at a shorter penis, a misshapen penis. It might have an hourglass shape where it's almost like a rubber band has been tied around it in the middle. Curvature, of course. We've had all kinds of stuff. As you can imagine, this leads to painful erections. And these painful erections can last a year. When a guy gets an erection and it hurts, guess what? He doesn't want to get an erection anymore. Now, to be clear, the curvature from Peyronies is different from natural curvature. You're not born with Peyronie's disease. It's something that happens later as a result of injury.
You know, we have men that come in here that have a 45-degree angle. I've even seen men with a 90-degree angle. Remember, this is plaque and scar tissue that's building up within that tunica albuginea, which is causing the shortening of the penis so that you can't get a full erection. Whatever it is, whatever your case is, get in and get treated right away. Remember, with this acute phase, you have about a year before it turns chronic. And when it turns chronic, it's more difficult to treat. So I highly recommend that you find a sexual wellness clinic near you, a healthcare provider near you, or come and visit us at the Novus Clinic.
Guys, you know if you've got a problem that you weren't born with. Guys are also terrible about taking care of themselves. We wait, we procrastinate. This doesn't get better on its own. Act now. We've got a lot of videos down below to check out. If you've got more you want to learn about this condition, reach out to your local healthcare provider or give us a call.
If you have any other questions about Peyronie's disease or what we offer here at the Novus Center, then please feel free to leave them in the comments below. Hope to see you soon.